Hello, it's Friday the 13th of November. Ironically, we have had 13 deaths since Wednesday. All of us know what's going on a national scene. On the national scene just this morning, it came across that yesterday we set an all-time record of 150,000 positive cases yesterday. We're at 248,000, I think is the right number of plus of people that have died in this country with COVID. Now, to put that in proper perspective, I think we lost 58,000 people in the Vietnam War. 13 years the Vietnam War went on, and we lost 58,000, if I'm correct. In 9 months, we have lost 248,000 Americans due to COVID. Honestly, we have got to realize what we're dealing with here. It is really, really a massive, massive killer. We've lost another 13 West Virginians since Wednesday, and today, on Friday the 13th, I'm going to read to you that the 553rd death is a 95-year-old female from Marshall County. Our 554th death, an 87-year-old female from Cabell County. Our 555th death, an 82-year-old male from Wayne County. Our 556th death, a 65-year-old male from Cabell County. Our 557th death, a 73-year-old male from Mercer County. Our 558th death, a 69-year-old female from McDowell County. Our 559th death, a 91-year-old male from Brooke County. Our 560th death, a 65-year-old female from Kanawha County. Our 561st death, a 66-year-old male from Hancock County. Our 562nd death, an 84-year-old male from Ritchie County. Our 563rd death, a 61-year-old female from Kanawha County. Our 564th death, an 83-year-old female from Barber County. Our 565th death, a 95-year-old female from Cabell County. Again, West Virginia, you have to realize that we are the oldest state. We are the state with the most critical or chronic illnesses. We absolutely have knocked it out of the park as far as the numbers and what we've done in comparison to others. And we still are continuing to do that. But West Virginia, you got to tighten up. That's all there is to it. The total number of cases in the last 24 hours that were positive in West Virginia were 742. That's the third day in a row we have exceeded over 700 new cases a day. We have 4,611 new positive cases in the last 7 days. The daily positivity rate is at 4.06 for the last 24 hours. Our cumulative percentage of positive cases is now at 3.14. We have active cases in West Virginia of 8,531. We have recovered cases of 22,543. Now get this. In West Virginia today, we have 339 people hospitalized. That's an all-time record. We have 104 patients in our ICU units, another all-time record. Yesterday, we tested almost 14,000 West Virginians, 13,992. That's good, and that will help us in the end. Our reproductive number, which is our RT numbers, at 1.14. We have no counties in the red right now. That's good, but we have 13 counties in the orange. Marshall, Mineral, Jefferson, Hardy, Barber, Randolph, Tyler, Wood, Fayette, Lincoln, Logan, Mingo, and Wyoming counties. I want to read to you a text that came to me yesterday evening from a delegate-to-be, a delegate-elect from Wood County. His name is Roger Conley, and he's a good man. Here's the text that he sent me. He said, "Governor, please keep fighting the good fight as you are. I am in the hospital for the second time in the past week fighting this terrible virus. People have got to just start listening. When I get through this, please let them know that if I can help in any way to help spread the word just how difficult and devastating this virus is, I will be glad to do so." And this came from Roger Conley, delegate-elect from Wood County. Now look, we got to do stuff. And so today, now we're moving to get more restrictive and do stuff. We have been pleading with everybody to go get tested. We had a hard time doing that, but at least today we have almost 14,000 people that are testing. We have been pleading with people over and over to wear their mask. We know the situation, that the vaccine is on the way, but it's not here yet. And we know what's going on across all of our land, across our nation. Today, I am issuing several executive orders. Today, I am announcing changes to the indoor face covering requirement that we already had. Beginning at midnight tonight, I will be issuing a mandatory to wear a face covering indoors in all public buildings at all times. This is not just when social distancing cannot be maintained. This is mandatory, wearing a face covering in all buildings at all times, other than your home. And this does apply to children, does not apply, rather, to children under the age of 9 years old. Or anyone who has a legitimate breathing problem and that they are unable to wear a mask. The only other exception is when you are in a restaurant and you are actively consuming food or drink. Other than that, you should have your mask on at all times. We are making this ultra mandatory, especially now, or making this as an ultra mandatory requirement at this time, especially for all of our businesses. We are also going to require all of our businesses to post signs to ensure the compliance with this order. I am calling for all business owners and managers in West Virginia to step up and make sure that everyone in these businesses is wearing a face covering all the time inside these buildings. Now, let me just say just this. Let's just go one step further and say to our business owners, I am telling you just straight up as straight up can be. The next thing that follows this is, you know what? And that is the shutting down of the businesses. It's the worst thing in the world that could happen in a holiday season from the standpoint of our retailers and all the hopes of good business and everything throughout our holiday season and everything. From the standpoint of where we are right now, if you don't step up, business owners, and make it mandatory when people are entering your businesses, absolutely, if you don't step up right now and do that, we are going to end up, as sure as I know my name, we're going to end up having to take further steps because we will not be able to slow this thing down and stop it. The next steps will have to be closure. From the standpoint of your business, if you post that sign outside and someone blatantly refuses and absolutely, and challenges going into your business or whatever it may be, call the police. That's all there is to it. Just call the police. From the standpoint of them, if they totally refuse and they're basically trying to enter your business, they're obstructing justice. And they absolutely will then suffer the consequences of that. Absolutely, if you as a business decide on your own, well, I'm not doing that, I'm just not going to do that, then you're in the same situation as far as obstruction. We have got to stop this. We have to stop this, and we have got to stop this now. From the standpoint of sports, we have been fortunate in West Virginia to be able to play sports in the fall. Virginia and Maryland have not had any fall sports. We have tried with all in us to be able to support our athletic teams and everything, and the commitment of athletics, because we know it's important, and we know it's an important fabric to all of us and everything. In doing so, now we're going to have to change again. At this point right now, from the standpoint of all our winter sports, we are moving all of our winter sports, and we are not going to conduct any of our winter sports. That's basketball, swimming, wrestling, and cheerleading will all be postponed until January the 11th. We are very hopeful that it's starting on January the 11th with practice. Everybody will start on a level playing field. This will give us the opportunity to settle this thing down. We'll finish our fall sports and everything, and we will begin our winter sports on January the 11th. So from the standpoint, I know the girls' basketball have started up and started practicing. I don't know about the wrestling and the cheerleading and the swimming, but from the standpoint, if you've already started up, it's over. It's over right now. It's over until January the 11th. We're hopeful to be able to play a full season and everything work out great, but these are indoor sports, and God knows, especially, I don't know how on this planet that we could possibly think about having wrestling, but basketball and all the indoor stuff it's just going to get worse. So from the standpoint of the hopeful, from being hopeful on a vaccine or calming this thing down and getting this thing, to where we've got a handle on it and everything, this is the right thing to do. And so I will sign an executive order today that says we're moving our winter sports to January the 11th. As far as travel ball, as far as the midget leagues, as far as little leagues or 4-H leagues or whatever, we will we will allow you to finish the fall sports. We will absolutely move the winter sports to the school calendar of January the 11th, meaning that we will not have any midget leagues or 4-H leagues or travel ball or whatever from the standpoint of basketball, wrestling, cheerleading, swimming. The winter sports will all stop, and we will start again on January the 11th. From the standpoint of finishing up, we may have a playoff or something like that, as far as a football thing or whatever like that, may have one game left. We'll allow the fall stuff to go ahead and finish. Okay, as far as school, from the standpoint of school, I am going to issue another executive order today that's going to be for all 55 counties, and it's just this. We all know that families are going to come together over Thanksgiving. And as families come together, we all know the probability of more of a spread is right at our fingertips again. We all know that some are going to go to school on Monday, Tuesday, Wednesday, and then break Thursday, Friday, Saturday. Some counties are doing that. Other counties are off the entire week of Thanksgiving. What my executive order is going to be is just this. From Thursday of Thanksgiving until the next Thursday, no one will go to school. So from Thursday of Thanksgiving, the next week, so you'll be out of school Thursday, Friday, Saturday of the week of Thanksgiving, and Monday, Tuesday, Wednesday of the week after Thanksgiving. That will give us that 7-day period that the medical experts tell us that will help us from the standpoint of our families all being together. And it will be true for public and private schools alike. From the standpoint of our bands, today at the recommendation of the bandmasters who oversee all the public school bands in West Virginia, I am announcing that we are canceling all band festivals this spring. I am also announcing the cancellation of all concert band festivals for the rest of the year. The bandmasters made this recommendation to the State Board of Education and to me, and we both agree that it's the right thing to do. Okay. All the testing, I want all West Virginians to be encouraged to get tested, especially before Thanksgiving and, before spending time with their loved ones. We have testing sites that are all up all over the state. We have free testing available to lots and lots and lots of people. Our drive-through pharmacies are up and working. We're continuing to expand the reach as far as being able to test more and more and more. You see, we tested 13,992 people yesterday. That's terrific and everything, and it will bear fruit. But right now, we've still got a long ways to go. Our school outbreaks, we've got 21 outbreaks in our schools, 118 confirmed cases, and that's all up on our website. We have 78 outbreaks in our long-term care facilities. That's significantly up. We have 19 outbreaks in 13 counties in our churches, in Cabell, Fayette, Hardy, Jefferson, Kanawha, Lewis, Mingo, Monroe, Raleigh, Ritchie, Tyler, Wood, and Wyoming counties. These outbreaks account for a total of 246 cases. I strongly encourage all West Virginians, especially in your church setting, to follow all the guidelines that I've said over and over and over about a pew in between you, and social distancing, wearing your mask especially, and on and on and on. At the Stevens Correctional Facility, where we're continuing to test inmates and staff, and that was completed yesterday. The McDowell County facility currently has 40 active inmate cases and 22 staff cases. Several leaders from corrections continue to provide guidance and support on this facility. The National Guard remains on standby for sanitization. Outside of Stevens, correction only has 5 inmate cases in the state and 29 on staff. But you see how this can go if you'll just think about it. We have only 5 inmate cases in the entire state, and we have only 29 staff cases in the entire state. At one facility right now, we have 40 inmate cases and 22 staff. When it gets there, it goes. And we got to absolutely try to prevent it getting there in every way. And Stevens is a county jail, so nevertheless, and is that right? Okay. But from our flu vaccine, it's available. Go get your flu shot, please. From our grants that are gone out to our cities and our counties, We're almost at 180 million. You know, I can continue to encourage everybody to apply and apply the same way. If you haven't gotten your CARES money in regard to your utility bills and whatever and all that cleaned up and everything, and I think that goes directly to the utility and everything to clean up your account. But follow up on that too. West Virginia, it's just as simple as just this. None of us want to do more with the restrictions and the rules and the closure and the postponements and the delays and all that. None of us want to do more. We want to be able to live our lives and go on about what we're doing. But West Virginia, this thing's bad. And it's getting worse all across our land, especially across our country. And West Virginia, you are the oldest, and you are the most chronically ill. And I love you. I love you with all my soul. And I want absolutely nothing but good, and I want you to be protected. We're, again, trying to do any and everything we can to give you as much normalcy in your life as we can possibly give you, and at the same time trying to protect in every way we possibly can. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. I want to reemphasize some of the really important comments the governor has made. We had the highest single day ever in the U.S. and therefore ever in the world for positive COVID-19 cases. We had over 150,000 cases. We have more people hospitalized at any time than we've had during the entire pandemic for COVID-19. We have 66,000 people, excuse me, in the U.S. hospitalized. We also know in West Virginia that we are seeing increasing numbers of patients with COVID-19 positivity and people with COVID-19 positivity, more people in the hospital than we've seen before. I know for many West Virginians and many people reading the news and that it's very scary to hear all this information. And I think that it's really important for us to refocus on the message that the governor sent almost on day one of this pandemic, that it's really time not to panic and not to be fearful, but to be resolved, that we will work together to make sure that we use our power, which we have today, to be able to stop the spread of COVID-19. And how do we do that? We do that by really simple measures, but we also do that by very much recommitting ourselves and re-energizing ourselves to make sure that we are answering the call for service, that, as the governor said many times, that we are running to the fire individually and together. We know today that the spread of COVID-19 around the country is really not from places of business or hospitals, et cetera. It's from communities. It's from community gatherings. It's from people getting together and feeling secure around people that you know and taking your masks off, or being at a celebration or a wedding or a dinner or a party. And we've seen that more and more be the primary source of spread. And particularly with the Thanksgiving holiday coming up and the other holidays, depending on what your religion is, Christmas or Hanukkah or Kwanzaa or others, then it's a time that families and friends and people who love each other come together. And during this time, it is particularly important for us to really follow some different strategies. And those different strategies are, number one, really reduce the number of people at these gatherings. Try to restrict these gatherings, if you need to do them in person, to people that are very, very close family. It's really important that if you're around people that are older or more susceptible, or really anybody, that you either quarantine yourself for 14 days before you do this, or go get a test. And there's free testing all over the state, and it's at the governor's website. And also that when we're together, it's really important that we do make sure that we are wearing our masks, that we are physically distancing, that we're avoiding big crowds of people. The indoor environment and the winter is worse because when people take their mask off indoor, the aerosols and droplets that can spread COVID-19 person to person can be suspended in the air for periods of at a time. And in the winter, the air is drier, and that allows those droplets to stay airborne even longer. So it's really important, West Virginia, for us to take this moment to recommit ourselves to the things that make West Virginia so great, which is love of service, love of country, love of state, love of community, love of each other, watching out for each other, altruism. And I think that West Virginia is always best at the moments of greatest needs, whether it's needs for the country or needs for the state or needs for your community. And it is that time. Because we know that the number of hospitalizations generally increases about 2 to 4 weeks after we see more cases, and the fact that we've always been in West Virginia a few weeks behind the rest of the country, we know that the hospitals are filling up all over the place. It is our time right now to recommit ourselves so that that does not happen in West Virginia, that we use our power, wear our masks, physically distance, stay away from people you don't know as much as you can, and pay great attention and re-energize yourself to this important call for action. And if we do this right, we not only will bridge to the vaccine, we will be able to slow the rate of COVID-19 down so that the vaccine will give us continued benefit, but we can get to where the vaccine will get us if we all just pull the rope together. So thank you so much.
All right, thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. On Monday, the 13th, we did report the 27 deaths from our death reports. One of those was a duplicate, a 76-year-old man from Mercer County. During our audit process that we continue to go over, we did find that, and we do continue to audit and might find ways to go over these. We did issue another health report out to make sure that we do not find these again, and to continue to find those errors that was found. But just wanted to make sure we went over that. It was a duplicate report. Thank you.
All right, thank you both. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. I'd like to reinforce a couple of things that are going on with the National Guard to reinforce what the governor has laid out and why it is so important. Understanding that people don't like the things that that we have to do, but we in the West Virginia National Guard today are beginning to work with nursing homes to put up isolation barriers in certain nursing homes because of outbreaks. We, in the last 13 our local and state partners, and running 388 test planes with over 15,000 tests just with National Guard personnel supporting. And this morning, Dr. Marsh, Secretary Crouch, and I met by phone with hospital leaders to begin to look at the challenges that we are going to face in managing hospital beds. And as the governor pointed out, this is the highest number of COVID hospitalizations that we've had so far to date. In addition to that, on our morning briefing this morning with the National Guard and DA, 88% of our total number of positive cases have occurred. So West Virginia, I understand, as do all the men and women of the National Guard on the front lines of this, the challenges that we present to you with the things that the governor's laid out and the sacrifices that we have to make. But we are doing this, and the governor is doing this in order for us to prevent the wave of what we're seeing in other places across the United States of America, where people can't get into hospitals, where people can't get the appropriate care. We're looking out for your best interest, and we appreciate your support. Thank you.
Thank you, General. West Virginia Superintendent of Schools Clayton Birch is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Brendan Tierney with WSAZ.
Hi, Brendan Tierney with WSAZ News Channel 3 here. My question is for the governor. Governor, I was hoping you could expand a little bit upon that kind of closure deadline that you had mentioned with those businesses having to put up the signs and things like that before they would possibly have to close down, where do you draw the line? When do you decide, okay, businesses have to actually close down now because the numbers have gotten so bad?
Well, Brendan, thank goodness we're not there. I really believe, I hope, you've got to be optimistic at this. I mean, this is tough enough, but you've got to be optimistic and think, if our businesses post their signs and really, really bear down about not letting people in their businesses that are not wearing masks, and they try with all in, they just buckle down another notch, harder. We sure hope and pray we're not going to have to close, make any closures of any businesses. But Brendan, we've got to know that just to tell it like it is, and to be just as upfront as I know how to be with people, and it's just this is, what's the next step? If this doesn't work and this disease continues rampant across our land, what are the probable next steps? I mean, look across the world at how different countries have completely shut down, and absolutely, what are the next steps? Think about our retailers just a second. This is their holiday season. This is the season which they do the very, very best. This is their year. Think about how devastating that would be. Think about the restaurant owners that are holding on, with the limited capacities and all that they've been going through and everything. Think about how devastating this would be to people that are just wanting a job, to be able to pay their utility bills and everything. But absolutely, we have got to all know that if we really don't step up right now, what has to come is the next level. But to say that I know, that if you don't do this on Thursday, we're going to end up closing stuff down on Monday, that's ridiculous. We don't need to be talking about that.
All right, thank you, Brendan. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, there's already question about the authority that you have and what you can exercise, and I know that's been explored by you and your legal team. But when you read off statistics that list churches, nursing homes, the areas that continually have outbreaks that are difficult to maintain and also involve our most vulnerable populations, at what point do you step into the legal arena and limit any type of worship service or nursing home visitations again and take your chances in court if the surge is as bad as what you're saying, and if the end results of not taking action would be catastrophic? Thank you.
Well, Kenny, I'd comment real quickly and just say just this is, our congregate problems are significant because once they get into a nursing home situation, they can get really tough. The same way with the church. From the standpoint of, let me take you back just a second and just tell you just this. On Wednesday, we met with the medical team. We're meeting nonstop, but, a big powwow with the medical team from the standpoint of the National Guard being there and everything. One of the things that you may have missed is along the way, we're making it mandatory that we're going to test the staff at all of our nursing homes a minimum of 2 times a week. Now, and we can do that, and we can achieve that. From the standpoint, Kenny, of congregate, if I'm or versus community spread, we got both going on. We've got both going on. And, from the standpoint of the need for our people to be able to go to church and to take that away from our people, Kenny, I hope and pray with all in me that won't become an alternative that I'll have to explore at all. Because that is really, at the end of the day, in my opinion, that's our pathway out of this. I mean, at the end of the day, I think with all in me, and I mean this so sincerely, that God above is going to take us out of this. And so I hope we don't have to go there at all. We're trying to improve the situations, whether they be nursing homes or whether they be our prisons or whether they be our churches and everything. But we have also got an equal, if not bigger, threat that we have right now is a community spread.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. My question deals with contact tracing. If we're looking at hospital beds and things like that as a capacity, I imagine contact tracing also has a capacity. My question is, are we reaching that capacity? Do we have enough people doing contact tracing? Are they falling behind? Where are we at with regard to contact tracing with the spike in cases?
I got to say one thing, and then is Secretary Crouch on today? Okay. But I've got to say this, Bill, you have got to tell the people that we have 200 contact tracers that are being underutilized, to say the very, very least. Maybe even not utilized at all. So from the standpoint, I mean, we have this situation, guys, in many situations, in many instances. You have the great work that people are doing within their counties, but their county is their baby, and they feel like they want to be able to take care of everything in their county. And so they don't really maybe want to use the help that we're screaming that we have to be able to help them, and at the same time they're wearing themselves out beyond belief. So Bill, talk to us about contact tracing.
Thank you, Governor, and you are absolutely correct. We have 200 individuals right now. Our capacity has not been tapped yet. We have approximately 450 total contact tracers. Right now, we have an excess or excess capacity individuals who are available to be used. And the governor's right, and I want to praise our local health department folks. They're doing an unbelievable job in a difficult situation. Everyone is exhausted, but we do have these folks trained and ready to go. We have 2 training locations, 2 training options for people who want to be contact tracers. One through DHHR and one through WVU. Once that course is completed, we now have the checks out system, which is an online system, so we can add contact tracers from a remote location to assist health departments. It is tough for health departments to do all of the work that needs to be done right now. So please call. We will schedule folks for you to assist you at any time. So the governor's correct, and we understand the difficulty in letting go of some of those things, and some are better than others, but we have folks available and ready for contact tracing anytime now.
Just 1 second. We need our medical team, Dr. Amjad or Dr. Marsh, weigh in on the hospital beds, because I want to continue to be transparent. I don't want our people to be afraid. I want our people to be concerned, but I don't want our people to be afraid. Please weigh in on that.
So maybe I'll start and then you can add in if that'd be okay.
Yes.
Okay. So the governor points out something that's really very critical for all of us. I know a lot of people get very scared when we talk about the hospitals filling up, because that's something that we've warned about from the very beginning of this pandemic. While we are seeing more people today in the hospitals that have been diagnosed and confirmed with COVID-19 or suspected probable COVID-19. We still have a significant hospital bed capacity in West Virginia. So the majority of hospital beds that are taken up are not from people with COVID-19. They're taken up from people who have other medical problems that they need to get treated for, their cancers, their heart disease, et cetera. But even with the numbers of people in the hospital, we still have a capacity opportunity in the hospitals in West Virginia. So we are not so full that we can't take anybody at any of our hospitals. We look at our ICU beds and our ventilators. We have plenty of capacity in the ICU beds across the state, and we have plenty of capacity in ventilators across the state. Somebody had posted, I think on Facebook, and I got a call from one of our delegates, that at certain hospitals, the ICUs might be full. What we know is that hospitals, particularly this time of year, tend to run very full, and our hospitals are no exception. But we're really seeing people mostly in all of our hospitals who are not the patients sick with COVID, but people sick with other medical problems or getting surgeries. And that's particularly prevalent around the end of the year when people are trying to use insurance opportunities or get things done before the holidays. So this is traditionally a very busy time for our hospitals. So I think people should not worry that we don't have any ability to take care of folks in West Virginia, because we absolutely do. But it is really important for us to recognize, just like other states are seeing too, that because we have always a lot of people that need care from medical teams and hospital beds, that additional stress of having people infected with COVID is an additional challenge for all of our hospitals. And when COVID gets active in the community, our staff and physicians and nurses and other people live in the community, so they get sick too, which further reduces our abilities to increase our number of beds if we need to. So that's the reason why it's really important for every West Virginian to really work hard right now to do the appropriate things with mask wearing and distancing and getting tested that you can, because we know that as cases go up, generally the numbers of people that need to go into the hospital over a 2 to 4 week period afterwards goes up. But today we are better at taking care of people with COVID. We have better drugs. We understand how to treat, which we didn't before. And so I think that this is not panic situation on the hospitals, but it is a warning opportunity for us to really get to focusing on doing the things that we can do to reduce the spread of COVID in the communities, which will automatically reduce the potential that we'll have to have more hospital beds, and the people that we need, those vital workers in the hospitals, will also get sick with COVID-19. I don't know if you have any other comments.
Just to add to that, to give some comfort to people, is that we need you to utilize your primary care providers at this time too. A lot of people are fearful to go see their doctors or even have their routine visits, but prevention is key, to get it. If you're a diabetic, if you have COPD or heart disease, to see your doctors now, to make sure you have your routine medications, get your routine checkups. If you don't feel well, to call them now, not to wait till you feel really, really bad and then just go to the emergency room. A lot of the emergency room visits can be taken care of by your family doctor if you see them ahead of time. But, Clay is right that we have the capacity right now. We also have St. Francis Surge Hospital that is ready. We have the ability to stand up Fairmont Hospital if needed. We're at a critical stage right now that we are capable of handling things, but we're also asking the public to utilize their healthcare providers appropriately right now. I've talked to a lot of healthcare providers that have not seen their patients. A lot of patients are fearful to go talk to their doctors or see them. They're afraid to get COVID in the clinic. And that's not true. You can wear your mask. You need to call your doctors. We really need you to see your doctors regularly right now so you can get that proper preventive care and avoid unnecessary ER visits. And that can also help us and help West Virginia keep our hospital numbers down. Thank you.
All right, thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News.
Could we expand a little bit more on the enforcement of this latest new mask order? You said that a business owner could call the police. Does that mean that this new executive order actually makes it a criminal offense to not wear a mask? I was under the impression, Governor, based on comments that you'd made before, that only the legislature had the ability to do that. So what does this order actually contain, and what is the enforcement?
Okay, I think you are correct in the fact that only the legislature can change law from the standpoint of making it a criminal offense. But now just stay with me just a second. I have been advised by counsel, our counsel, that if I make a mandatory order and someone, is approached by a police officer, and the police officer asks them or tells them that we are under a state mandatory executive order from the governor, and you have got to wear your mask in the building, and they refuse to do so, I have been advised by my counsel that they can be charged with obstruction of justice.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. Governor, I'm wondering what, if any, conversations you've had with our neighboring governors, specifically Governor DeWine in Ohio, Governor Beshear in Kentucky. They have indicated in the last couple of days that they are getting very close to shutting down bars and restaurants and perhaps retail stores. And I'm wondering about if that needs to be coordinated, because one can imagine a scenario where Ohio and Kentucky shut down their bars, restaurants, and retailers, and people come, across the border pouring into Huntington and Parkersburg and Wheeling and places like that to do their shopping and eating. And so how much have you talked to the other governors, and do you think you have to have a coordinated effort on this?
Mark, we are constantly monitoring all the things that are going on with all of our bordering states. And there's lots and lots of conversation that's going on back and forth between lots of people and everything. To just be perfectly honest, more than anything, those states are trying to mimic or trying to get like what in the world, all the goodness that is going on in West Virginia. I don't need to dwell on that. At the end of the day, we've got 565 people that have died in West Virginia, and that's terrible in my book in every way. From the standpoint of Ohio is ready to implode. Kentucky is absolutely having all the problems that they can possibly have as well. West Virginia is nowhere close to that level, but we are watching. We are watching very closely, because you're exactly right. In many situations, a coordinated effort would be beneficial. And from the standpoint of what we're doing with all of our border communities and so on like that, we're going to do whatever we have to do to keep them safe. Now, Mark, there's no point in trying to go through all the play-by-plays and all the conversations, because there's lots and lots and lots of conversations. We're watching everything that's going on in those bordering states.
All right, thank you, Mark. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Happy Friday. Governor, health experts like Dr. Marsh say one of the major sources of outbreak right now is small gatherings. If the virus is being passed through dinner parties, family game nights, or sleepovers, what should government's role be? To set a good example? Are there additional public information efforts up ahead for precautions? Last week, for example, you mentioned a public service campaign involving prominent college coaches. Thank you.
Brad, when this thing drops down, and this is just me speaking from my heart, but when this thing drops down to the level of us saying, we're really concerned about, and we are, about, families getting together over Thanksgiving, or, small groups getting together. Maybe even way less than 10 people, that are getting together, three neighbors getting together and having a 7-person little birthday party for their children or whatever it may be, and to say, well, what should government do? What more can government do? And I would say, from the standpoint of the PSA, from the standpoint of, what we're doing with the coaches, from all the stuff across social media, from me sitting here and telling people over and over and over, it's working. It's working because for the most part, our people are concerned, but we know we have got to do better. And from the standpoint of it's just, with the avalanche of people across this land that are saying wear a mask, it's just silly to be in a public building with strangers walking around with no mask on. It's silly. And even if you have this macho belief or whatever it may be, it's just silly. Why not take an extra level of precaution? What skin off your nose is it? Really and truly. How big a deal is it to just wear a mask when you go in a building and everything, when you're not at your home or out, whatever, really socially distanced, like in the woods hunting or whatever it may be. How hard could it possibly be? But we know from all the health experts all across our land, Republican, Democrat, independent, black, white, rich, poor, we know all across our land that everybody is saying wear a mask. Everybody. So from the standpoint of how can we do better to maybe inform people, from our families and our small groups that Brad, you're talking about, the media, our pastors, our business people, our coaches, everybody should be stepping up, trying to help and trying to do everything we possibly can. Now, there's all kinds of holes we can shoot in what we're trying to do here, but I'm telling you, the overall message of what we're doing here is the right stuff.
All right, thank you, Brad. Next to David Beard with the Dominion Post.
Hi, my editors brought to my attention a recent USA Today article that reported that we're one of 8 states that don't report our child COVID morbidity data to the American Academy of Pediatrics for their state data report. And we're also one of just a few that doesn't report our child COVID hospitalization data. So we wanted to ask the reasoning behind us being an outlier in those couple areas. And the fact that we are an outlier suggests that maybe it's not a privacy issue, but something else. If you could explain that for us. Thanks.
Dr. Onjot or Secretary Krauts, this is y'all.
Yes, thank you, Governor. We'll have to look into that. I really don't have a good answer for you on that. I felt certain we had child morbidity data, whether that's published or not. And if you're speaking specifically, I couldn't quite pick up everything, but if you're speaking specifically of hospitalizations, those that were hospitalized due to COVID, that's a different issue. So we may want some clarification on your question, but we're happy to get that information and get that for you.
All right, thank you, David. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. We've gotten some reports out of Monroe County of people going to free testing locations and being denied testing due to a lack of insurance or ability to pay out of pocket. They're apparently being asked for pay stubs for billing purposes, and these are locations that are listed on the official sites as free testing facilities. Without blowing anyone up in particular, have there been any other wider spread reports of this? Is it just a misunderstanding or a reporting issue? And how should people handle it if they find themselves in a situation to where they are being denied testing for financial reasons? Thank you.
General Hoyer, or maybe Dr. Amjad or someone can answer that other than me. I've not heard any reports like that at all, but General Hoyer?
Governor, I've not heard anything from our National Guard staff. We'll obviously look at it with our DHHR partners and our partners from Monroe County, try to identify what test lanes they're referring to and where there might be an issue we need to resolve.
All right, thank you, Matthew. Next to Lacey Pearson with the Charleston Gazette-Mail.
Thanks, Governor. This is Lacey Pearson with the Charleston Gazette-Mail. Governor, or this might be for Superintendent Birch as well, I wanted a little clarification on the post-Thanksgiving school shutdown. Is the shutdown just for physical in-person classes, or can students in schools that are offering online classes still perform online classes, or is it just no school, no lessons at all? Thank you.
I'm sorry. I didn't. You've got to forgive. My hearing's not the greatest, and Clayton, could you answer that?
I was hoping you heard it better than I did.
Okay, go ahead. No,
but Lacey, I think if you're, are you referring to the 3 days after Thanksgiving?
Yes, the following week. If you want me to repeat it, just to clarify whether it's in-person classes only shut down, or if students are taking online classes, can they still do their online classes?
Absolutely. So those in virtual school, there'll be no disruption. Those 3 days will go to a remote learning. All of the counties have plans for that, and we will also ensure that meals continue during those 3 days, just as school was in session.
All right, thank you, Lacey. Governor, I'll turn it back to you.
Okay. Well, let me run through this real quick, and I hope I've not left something out. But today, basically, I am issuing an executive order that says that it is mandatory. The social distancing is removed. It is mandatory that we wear masks in all buildings, outside of our homes. It is mandatory that the businesses post signs. All this is going into effect as of midnight tonight. We are absolutely encouraging all of our businesses to really step up and absolutely make it mandatory before you allow people in your places of business that they have a mask on. And so please help us in every way there. I really, truly believe that will help in many ways, as do all the health officials and everyone, as I described, across all this nation as well as the globe. I am issuing an executive order that says that our nursing homes have to be, our staff in our nursing homes will have to be tested every 2 weeks, or twice a week, rather. I'm sorry about the 2 weeks, but they will be tested at all nursing homes twice a week. I'm issuing an executive order that we will go 7 days from and including Thanksgiving before we go back to school, because that will give us that time period to where we can identify people if we have a situation that's happened at a family gathering. I am issuing an executive order that all our winter sports will be moved to January the 11th as a start date. I am very hopeful, and I am asking that the SSAC, look at moving the requirement of 14 days of practice down to 7 or 10 days upon that start back up on January the 11th. I'm issuing an executive order that all of our Pee Wee leagues and everything, that are out there, travel ball, all of them will, all of the winter sports, that's basketball, wrestling, swimming, cheerleading, all those winter activities, sports will cease now and will begin with the school date of January the 11th. And so from the other part, I want to walk you through the meetings, but there's thousands of emails and meetings going on all the time, but we've worked diligently with the governor's office, the Board of Education, the SSAC, the medical community, and if I could just take you back just a second and everything, on Wednesday we had more of a medical meeting, you know, with the governor's office and the medical teams, the National Guard and everybody. At that point in time, we felt like that we were going to move to a 7-day, you know, after the briefing on Wednesday we met, a 7-day from Thanksgiving, situation like we did with an executive order there and an executive order in regard to masks. We didn't tighten it up from the standpoint of our businesses and putting up signs and everything. We've done that since then. You know, our National Guard reported to us, you know, on the testing at our nursing homes that we really could be proactive and do our staff twice a week. And so we felt like out of that meeting, what we would do is we would go to 7 days from Thanksgiving before we go back to school, go to mandatory mask in our buildings, and we've put a little more tightening into that since Wednesday, and the nursing home issue of testing the staff twice a week. You know, then yesterday we had more extensive meetings. This was more of an education meeting and everything in regard to what are we going to do with these winter sports and what are we going to do with the situation, and really and truly that our teams are going places and they're playing and we're getting all kinds of outbreaks here and there and everything with our sports stuff. And so what are we going to do? And we worked through all that and decided to move our winter sports until January. This is all with the efforts and the contact and all the discussions with the SSAC and the education department, as well as what are we going to do with our Pee Wee leagues and travel ball and all from all the winter sports. We moved all of that till January the 11th, and we decided on our fall sports, the finishing of our volleyball tournament, the finishing of our football playoff on the teams and everything that are not going to be in the orange or the red. And believe me, the way this is looking, that's getting less and less and less every day. But we're going to try to finish up our fall sports and then move our winter sports, and that was the conclusion of that meeting. And so trust me when I tell you just this, that these experts are working night and day. All of us are absolutely trying to do everything we can possibly do to keep life as close to normal as we possibly can, to not devastate our economy and everything from an economic standpoint and devastate our jobs and absolutely make things so restrictive that we can't hardly breathe. You know, from that, all of us have got to know we've got to make it to this vaccine. And we hope and pray the vaccine will be as successful as what is advertised. But believe me, West Virginia, you know, I get report after report after report, you know, Governor, you look really bad and you look really tired and all that. And I'm sure I've probably looked bad all my life, and so I'll just have to live with that. But from the standpoint of tired, we're all tired. So what? You know, at the end of the day, we've got to just catch another gear, and we've got to do everything we possibly can to keep our people safe, to try to educate our kids, and to try to absolutely not just devastate our lifestyles. And so everybody's trying to do that. Help us in every way you possibly can, West Virginia, and keep just doing the good work you're doing. We're going to get through this. Everybody here is making the right moves and pushing the right buttons to the very best of all their abilities. Thank you so much.